will discuss a brief overview of informatics, the mechanism moving healthcare forward. Click on to learn all about how this specialty is changing the landscape of the healthcare profession. Informatics is a quickly expanding field in healthcare. As we continue to leverage more technology to deliver care, the demand for informatics nurses and the importance of nurse leaders to understand informatics will continue to rise as well. With the increase in technology, someone needs to be persistently examining the use, benefits, limitations, and alternatives. Informatics nurses understand both the technical and the clinical side and are able to bridge that knowledge and communication gap, offering meaningful solutions. They can take a particular problem and propose new technology or increased utilization of a current technology to solve the issue. For instance, if a nurse leader notes that her nurses are only 70% compliant with barcode medication administration, the informatics nurse may find that they need wireless scanners to reach the patient, or they have wireless scanners and are unable to reach the docking station, so they need to have wired scanners because the scanners are never charged. Today's nurses are often asked to do more with less. They need to be incredibly efficient while still delivering quality care, documentation standards, and identified benchmarks. Nurse leaders need to provide the environment for this level of care to be possible, with adequate staffing, including shift scheduling, and clinical area and competency allocation. They also need to ensure the tools to deliver the actual care are available. Informatics can enhance staff management, scheduling, supply chain management, and documentation to demonstrate the level of care provided. Nurse leaders and administrators who have a foundational knowledge can seek out technology or a nursing informatics expert to help address an identified concern. For instance, nurses waste time looking for needed supplies, so a knowledgeable informatics nurse leader could look at ways to address the communication, tracking of PAR levels, and delivery from supply chain management to cut out the waste while maintaining needed supplies. Data mining is how information is collected and interpreted. With the use of an electronic health record, there's concern that we're becoming data-rich and information-poor. A savvy informatics team will assist a clinical area to ensure the knowledge they need is captured and delivered. This may be through education, new program builds, upgrades, or looking at data in a different way. For example, if a nurse leader finds that their pain reassessment documentation is far below other areas of the hospital, is it because their nurses aren't educated that they need to be documenting the pain and reassessing? Or is it that they're documenting in a different area that isn't being captured in the way the data is currently mined? Or is it that they're not documenting it at all? And whichever the case is, then the informatics nurse can work with them to either increase education on how exactly to document the pain or work with an IT team to make sure the build is appropriate for the clinical area, or see if the data can be mined in a different way. Finally, knowledge gained from data mining can be used to reach the best possible patient outcomes. Best practice alerts such as infection isolation prompting, or safety alerts such as an allergy warning, can be built to populate based on real-time data mined from the electronic health record to deliver the right information to the right person in the right place at the right time in order to influence patient care. Nursing informatics has a growing impact on patient care and will assist with improved care delivery and patient outcomes. As technological capabilities continue to expand, informatics will be the means to translate that technology to meaningful use in the clinical setting.